make your classroom a safe space, right? If the students don't feel comfortable approaching you, if they feel like, every lecture that they have with you, something is said, something is done to make them feel other than, I think that is very important to create that safe space.
What if creating a bias-aware classroom could transform how students learn and how we care for patients? Welcome to the Lippincott Spark, Illuminating Nursing Education podcast. I'm Dr. Kelly Drees. Join us as we ignite your passion for nursing education and leadership. We'll explore the latest trends, hear from expert nurses, and provide tools to keep you inspired. Let's dive into today's episode and continue your professional development journey together. Hi there. In today's episode, we'll explore a critical and timely topic, implicit bias in nursing education. What if the key to student success starts with recognizing our own biases? Implicit bias can quietly shape how we teach, how students learn, and how we care for patients, often without us even realizing it. In today's episode, we'll dive into how nurse educators can identify and address these hidden influences to create a more inclusive, equitable, and effective learning environments. Joining us today is Dr. Sonique Sailsman, a certified nurse educator with over 25 years experience in acute care pediatrics, a transformational leader in addressing health disparities and bias in care. Sonique brings a passion for mentoring and evidence-based teaching to today's conversation. Let's get started. Welcome, Sonique.
Hello, good morning.
Hello.
Kelly, how are you?
Good. How are you doing today?
I'm good. I'm so happy to be here and talk about this very important topic that can be shared across nursing education and with nursing educators.
Excellent. As we begin to unpack this, as you said, really important topic, let's begin with the foundation, kind of understanding what implicit bias really is. So can you maybe help define it and share how faculty can begin to recognize it and address it in their teaching and interaction with students?
The American Psychological Association defines implicit bias as a negative attitude of which one is not aware against a specific social group. It is thought to be shaped by experience and based on learned association. And, that's just kind of the standardized definition, but I've kind of come up with my own unofficial definition, and it's a little bit more simplified. I see it as when a person has negative perceptions and blind spots towards others that they're not aware of that can surface at any time. And so when that relates to nursing education, it can surface in the classroom and with interactions with students.
What are the consequences of that, both for students and even patient care, when faculty fail to confront their own biases?
Well, I think that the consequences are great. It's a disruption in the quality of care and safe patient care. For me, I see faculty as a mirror to students in the world of nursing care. So the students can then, if they are exposed to implicit bias from perhaps their faculty member, it is the development of behaviors that shape their healthcare professional experience. And so the reality, Kelly, is that most nurses practicing today are emulating some of the behaviors from their nursing faculty. So their clinical faculty, their preceptors, we've all had a stamp placed on us, essentially a light stamp, a hard stamp. And these behaviors can influence the development of implicit bias.
I was reading an article in a nursing journal on implicit bias, and it talked about how it really can affect clinical communication and mentorship and even career advancement. And of course, patient care, like you had mentioned. And that health disparities, even in pain management and diagnostic accuracy. So it can be across the board for sure. So what are some common, I'll say, misconceptions about implicit bias in nursing education? How do these affect student engagement and learning when we see this happening in the classroom or lab or clinical?
one of the things that I think about is that because we are nurses, because faculty are nurses, is that we don't have implicit bias, or we have less implicit bias because we are nurses. And that's not true. That's a misconception. And that also that the biases that we have as people. So let me just clarify that as well. Everyone has some sort of bias, right? Some of us have implicit biases, some of us have explicit biases, but everyone is walking around with bias. So that was my little sidestep, and
Yeah.
now come back into the conversation.
Makes sense.
And then
Makes sense.
exactly. And then the second part of that is that bias can be hidden from students. And, that implicit bias that we talked about, it's that unconscious, those feelings and thoughts towards others that sometimes comes out in different ways. And it's called implicit bias because it's unconscious. But it comes out in ways of teaching, how students are treated, decisions that are made, and microaggressions. And the term microaggressions has kind of increased in popularity, for lack of a better term, over time. And I think it's important for us to understand what microaggressions are. It can be a comment or an action that subtly and often unconsciously or unintentionally expresses prejudice attitudes towards a member of a marginalized group. And so we have to be aware of possible microaggressions. I have encountered folks that didn't even know that what they said or what they did was a microaggression. And I can give you some examples of microaggressions. So like an insensitive statement, like, you speak really good English. Right? To that person, to the person saying it, to the nursing faculty saying it, that is, to them, that's a compliment. Right? But that is actually a microaggression because you're saying that you didn't expect them to speak good English, right? Where are you really from, right? You're so articulate for blank. It could be for a particular race, for a particular ethnic group, etc. I didn't expect a person from blank, let's say a particular city or country, to be studying here at my school, right? A disregard for pronoun use, making assumptions about sexual orientation, exclusion of students with disabilities and making assumptions about their abilities. Okay. You can observe that the student has a disability, but if you don't ask any questions, you are making an assumption about their ability. And then calling on students based on race, social status, or assumed knowledge of a particular topic.
Absolutely.
Those are some microaggressions.
Yeah. And, I appreciate the definition because, like you said, sometimes as a nursing faculty, I mean it as an endearing comment or a compliment. Like, you speak really, really great English. But it is definitely a microaggression. And I'm wondering, are there any other stories or experiences, either from your own teaching or clinical practice, where you've seen this show up in clinical or your classroom, and how was it recognized and addressed?
My experience over time, and I've been an educator for quite a while, I've been a nurse for quite a while as well. This was many years ago where I was an adjunct faculty, and as an adjunct, my role was to be engaged with the skills validations in the lab. And this particular time, I was sitting next to another faculty that was observing the skills validation checkoff, and it was with a student that English was their second language, and they were having some difficulty with articulating the words for the location of an anatomical position, etc. So they were having some trouble with that, and the faculty member was giving them a pretty hard time. But from my observation, I could see that the student knew the information. They were just kind of getting their words mixed up and kind of stepping over their words. And the faculty member was not gracious at all, and it was very difficult to watch. And ultimately, the student was not passed on that skill. And my observation of that is that I probably would have handled that differently. And this was a while back before, where I am today and the knowledge that I've gained about implicit bias, cultural competence, cultural humility, etc. But looking back, I would say that observation of that could have been handled differently because it was very clear that the student knew the information. It was just that they needed more time to process and translate. And when I've talked to students who are English as second language speakers, what they have shared with me is that everything takes longer because I am translating. I'm constantly translating. When you speak to me, I translate it into my language and then I translate it back to English and then I write it down or I say it. So that experience for me was really very much an eye opener, and it actually opened up humility for me with my English as second language students and how I can be more patient with them. It's not because they don't know the information, it's because there's a process of translation.
That gives us definitely a strong foundation kind of for understanding that presence, that impact of implicit bias and, microaggressions. So if we shift to something just as important, how faculty can turn that awareness inward and begin the work of self-reflection and growth. So I guess my question to you is, to have that great situational awareness, what self-reflection practices can help faculty uncover and address their own biases?
Self-reflection for anyone is important, right? To uncover those blind spots that I talked about before. And that's what implicit bias is. It's having some blind spots within yourself about specific groups of people, right? First of all, it takes two things: emotional maturity, and it takes a willingness to change, right? If you don't have those two things, you're going to have a very difficult time in moving forward in identifying those implicit biases. So the first step is to be aware of thoughts and feelings as they arise. That's what I think. It's like, as things come up in you, be aware of those things, and then ask yourself, what is my intention when I make this statement? When I say this in front of this class, when I make this comment, when I bring in this anecdotal information, what is my intention? Is my intention to inform students? Okay, so if I'm bringing up this information and let's just say it's a topic related to health disparities or inequity, am I sharing the other information related to what's called intersectionality, which is the variables that cause this particular event or processes to happen within this group of people, right? So engage in deep self-assessment, asking yourself these questions. This can be an ongoing conversation with yourself, or it can be over time. Do I interact with people that have different lived experiences than me? Are there social issues that I purposefully avoid learning more about? Do I recognize my privilege? Okay. Do I talk more than I listen when it comes to social issues? Sometimes we have these notions that, that doesn't apply to me. That doesn't, so you kind of block it off. So are you just constantly sharing your opinion about things, or are you listening to what is going on? Could my lack of engagement with people different from me impact what I say and how it is said? Okay. So if my world is very small and I'm not around, certain types of people, etc., could that have an impact on what I say to my students and how I say and how I teach particular content?
One of the faculty had, this was many, many, many years ago. Like you said, there needs to be emotional maturity. And when I first started off in nursing, one of the faculty had said something to a student that was just a little bit off. Like you said, it was a little bit demeaning, but yet it was well intended. And I remember them coming to me and saying, "What did I do? What did I say? Was that wrong? Like, I don't know any better. I don't know the rules of engagement and what I can say and what I can't say. And how do I learn that?" So I guess my question to you is, how can nursing programs support faculty in building inclusive, bias-aware teaching practices? Because new nurse educators stepping into this classroom, they might not have that skill set. So how do you build that?
I think what's really important is to engage in conversations, right? So as the semester begins, most schools and universities, et cetera, they have that first couple of weeks before the semester starts where there's meetings, there's gatherings, et cetera. I think those are the perfect times to have like breakout sessions or seminars where faculty can really begin to talk about who they are, just them as faculty, who they are, and I think sometimes that's where the conversation needs to happen, is amongst the faculty themselves, getting to know your colleagues, right? Who is the new faculty member, or this faculty member has been here for 3 years and, they may be from a different culture, they may be from a different religion, but we don't really know much about them. So have the opportunity for people to share about themselves and then get to know each other as faculty, like beyond these, one-off meetings here and there. And then ensure that students see the faculty in your nursing program as safe. Okay. Now, if faculty don't feel safe amongst each other, how can then students feel safe with faculty? And then I also think about seeking out training and make cultural competence an expectation among faculty, because then it'll just trickle down into the faculty bringing that into the classroom. Where I see the disconnect is when the leadership doesn't actually require that of the faculty.
So self-awareness is a powerful first step, but how do we actually translate that into action? So if we talk about what inclusive bias aware teaching actually looks like, what are some strategies? You're starting off Monday morning, you've got a new class. How do faculty use, what strategies do they use to model bias-free behavior?
As I mentioned before, reflection. I cannot say reflection. I can't say reflection too much because I just think it's so important. It's that self-work that translates in front of the students. Make your classroom a safe space, right? If the students don't feel comfortable approaching you, if they feel like, every lecture that they have with you, something is said, something is done to make them feel other than, I think that is very important to create that safe space. One thing that I tell my colleagues a lot is to learn their names. I know. And they're like, all 100 of them? Yes. Yeah. All 100 of them. Who are they? Who are my students? Because one thing that I've learned from students anecdotally or through evaluations is that when you get to know them on beyond them just being a number on a list, they truly appreciate that. And that's where that safe space comes in, when you get to know who they are. And you don't have to be invasive. You don't have to just go at them with questions, because once you let your armor down, they start letting their armor down. And that's when the safety starts happening. And that's when the understanding of who they are starts happening. I think what's very important is that your lectures should reflect people from multiple cultures and abilities. Show someone in a wheelchair in your pictures in your lectures. So show someone wearing a hijab. Show people of color. Show range of ages. I think that's a really big step for faculty, is that we need to really get outside of that cookie cutter kind of box of, those same pictures that are used over and over again, and no thought being given to the audience that you're projecting to, or if you live in a particular metropolitan city, and, you have a particular ethnic group that lives in that city, show those people in your slides. Why not? There's no rule. Right? So I think that's very important. And then also provide implicit bias training for students. I have a peer that was part of a cohort that I was in, the NLN Social Determinants of Health and Social Change Leadership Academy. And she developed implicit bias training for students. And what that did, it provided education for students about perpetuating discrimination, encouraging to confront bias, and then it addresses the root causes of inequality. So I think that's really important.
Yeah, so very important to get that information to students. And it's about that curriculum design and the case studies we use and kind of active learning to promote that equity and inclusion. And do you have any other examples that using those kind of strategies to build that out in your classroom?
What's really important is going beyond those cookie cutter type case studies. I call it cookie cutter cases from the 70s, right? Textbooks today are doing a great job of providing more detailed and leveled case studies. So it's not just your standard, but add in difficult social experiences like homelessness, shelter insecurity, immigration status, language barriers, financial burden, food deserts. Add those in as variables in your case study, right? These are elements that the students will have to dig into a little bit deeper versus just your general med surge. Like, yes, that's part of your case study, but if you add in, that they are shelter insecure, if you add in that they're food insecure, that opens up their minds. And those things don't have to be relegated to population health and community health. They can be in your med surge class. They can be in your acute care class.
Yeah.
Yeah.
And I think a lot of faculty don't really realize that's for the population health class, and to be able to bring it into these other classes definitely would help as well. So, these are, I love these. These are great strategies. So let's talk a little bit about how we know if they're working. What does progress look like and how can we measure it meaningfully? So I guess my question to you would be, how can faculty evaluate the effectiveness of their efforts to reduce bias?
And the thing with bias and implicit bias is that it's abstract, right? It's not a concrete thing. It's it's when it happens. It's microaggressions. It's all of these little different variables. I think two questions that faculty can ask themselves about effectiveness is, have students stopped saying the same thing about your character or the feeling of your class in your evaluations over time? So looking at your evaluation semester after semester, right? Has it changed? Can you see that you've done the self-reflection and it has now been incorporated into your teaching? And then you can see it in your evaluations. The things that students are saying about you, the things students are saying about the comfort in your class, that has changed.
Took the words right out of my mouth. My next question was going to be, what role does student feedback play in shaping more of an inclusive teaching, approaches? Because you'll see that change from, your first class and all the way through then, hopefully, as you make those adjustments for sure. So before we wrap up, I like to ask each guest to leave our listeners with a closing spark or a powerful takeaway or nugget of wisdom that they can carry with them after today's conversation. So what spark would you like to leave with them?
This is a topic that has become very near and dear to me. Implicit bias, teaching about implicit bias, letting faculty know that you do have it, you have to explore it. I want faculty to recognize and offer to be an example of unbiased care that they want to see in their students. I would like to see faculty to engage in regular self-reflection so you can be aware of the blind spots that I talked about that you may have. Those blind spots, once you get rid of them, will help to influence the students and the next generation of care providers. So that's the spark. Self-reflection, addressing those blind spots and recognizing that you are creating our next generation of caregivers.
I really appreciate your time in sharing these, stories. You've definitely sparked meaningful reflection and inspired us really to take a closer look at our own teaching practices. And sometimes that can be uncomfortable as far as really facing our own biases. But as I think educators, we're reminded to be the example of unbiased care, unbiased leadership. We hope, as you said, to see in our students. And that starts with self-reflection, recognizing those blind spots, embracing opportunities to grow and continue to grow so that we can support the next generation these nursing students entering into the field. So stay tuned for more episodes that light the way in nursing education and practice. And until next time, keep the spark alive. And thank you again, Sonique.
Thank you.
Thank you for joining the Lippincott Spark Illuminating Nursing Education podcast. Enjoy this episode, subscribe, share, and leave us a 5-star review. For more information, click on the link below to learn more about Lippincott Nursing products and services. Until next time, keep leading, learning, and making a difference in nursing education.